So today we are going to talk about BCG. So we are going to go through everything you need to know about BCG, which is Basil Calmette Guerin vaccine. So identification features of BCG vaccine. So how can you know that this is BCG vaccine apart from you reading there? Okay. So on the bottle, the vaccine is available in dark bottles to protect from sunlight, and some bottles have a long neck as the vaccine is packed in vacuum. So types of vaccines. So what are the types of vaccines of BCG? So we have live ones. So they are live attenuated vaccines, and we also have freeze dried powder. So these are the two types which are available, but especially the one being shown here in the picture. So what's the dosage for BCG? So for institutional deliveries, 0.05 mils at the time of birth, or up to up to the age of 4 weeks. So that's when you give. So you give at the time of birth, or the maximum is up to the age of 4 weeks. That's when you can give 0.05. But in cases of home delivery, if given at 6 weeks, then 0.1 mils along with pentavalent 1 and other routine vaccines. So there are, if a case of home delivery, then when you are going to give it at 6 weeks, then you remember your immunization schedule, you find that at 6 weeks we have other vaccines which are supposed to be given there. So you actually have to give, you have to give BCG, and you give the other vaccines as well. So don't skip them, just give together BCG and the others, the pentavalent vaccines. Okay, then what's the route of administration? So the route is strictly intradermal injection. So that's the route. So as you can see in the picture, it's showing that you have to go in between the epidermis and the dermis, so intradermal. Okay, so site of injection. So for site of injection it differs, but in a country should be uniform. So in the ear, in our setup, is in the upper part of the left arm, so to maintain uniformity and for helping surveyors in verifying the recipient of the vaccines. So that's how EA is done. But others find that it's done in the deltoid of the left arm. So again, everyone on BCG is given there and for the same reason, to maintain uniformity. So they just, if it's the deltoid, you have to give everyone in the country at the deltoid muscle. Then if the injection site is too high, too anterior or posterior, the adjacent lymph node may get involved, inflamed, and tender. So schedule of immunization. So single dose at birth, which I think we mentioned, and if you don't give at birth, you have to give at 6 weeks, along with the routine vaccination at 6 weeks of age. So follow through the immunization schedule. Then precautions. What are some of the precautions you can precautions while injecting BCG? So injection should remain intradermal. Then do not use antiseptic before injection. Then the other thing is, if spirit has been applied, wait for it to completely dry off before injecting the vaccine. Then for 6 months, no injection should be given in the same arm in which BCG was given. So that's another precaution. Then what is the reason for giving BCG through strictly intradermal route? What if the dose goes deeper, e.g. subcutaneous? So what do you think the answer is for this one? So if BCG vaccine penetrates into the deeper tissue, it can cause local abscess and enlarge and painful axillary lymph nodes. Okay, so there is a small chance of this infection getting disseminated too. Then if the cellular immunity of the recipient is low. Okay, so the another question, so we are going to talk about everything you need to know on BCG. So why do we give 0.5 mils dose of BCG to newborns below 1 month of age? Okay, so the reason is this is because the skin of newborns is thin and an intradermal injection of 0.1 mil may break the skin and penetrate into the deeper tissue, and this may cause local abscess and enlarge axillary lymph nodes. So which strain is used? So you know that BCG uses one of the strains, so which one exactly? So there are a lot of other strains. So Danish 1331 or Danish 1331 is the WHO World Health Organization recommended strain of bacteria for the production of vaccine. So reconstitution, how do you make? So normal saline is the recommended diluent, and the reconstituted vaccine may be used up to 3 hours, and leftover should be discarded. So don't use the leftover, you have to discard it. Then the other question is, why can't we use distilled water as diluent when normal saline is not available? So why can't we use distilled water? So distilled water is an irritant to the skin, as BCG is to be given intradermally. Distilled water can cause irritation of the skin, which may cause ulceration at the site of injection, and in severe cases even sloughing of the skin can occur. So what are some of the complications of you giving BCG vaccine? So there can be prolonged ulceration at the vaccination site, there can be severe ulceration, there can be suppurative lymphadenitis, tubercular osteomyelitis, disseminated BCG infection, also known as BCG ositis, or BCG osis, and even death can occur. So how do you store the vaccine? So long-term storage, you have to use at pHC 15 degrees to 20 degrees Celsius in the deep freezer. Then the vaccine may be stored between 2 degrees Celsius to 8 degrees Celsius for a few weeks at a place of use, such as the sub-center. Then you also have to protect from light. Then the other thing is you have to know is the protective efficacy of BCG. So approximately 15 to 20 years, that's how effective it can be. And the protection is partial protection, it's not full protection. So it is believed that BCG may offer only partial protection from TB, but it seems to prevent severe forms of childhood tuberculosis, such as miliary tuberculosis and tubercular meningitis. And there is even, I think I came across this in an MCQ which was asking about BCG, how effective it was. So bear in mind of this one. It's an MCQ kind of question. They ask you about BCG, and they show you that it's more effective on tubercular meningitis or miliary tuberculosis, which is true. That's how it works well on, or it prevents severe forms of this childhood tuberculosis. Then what's the normal reaction after you have been given BCG vaccination? So immediately after a satisfactory injection, we of 5 millimeters in diameter, which later subsides. Then after 2 to 3 weeks, a papule develops, which gradually grows in size until 4 to 8 millimeters. Then after 5 weeks, the papule subsides or breaks down into a shallow ulcer, usually covered with a crust. Then within 6 to 12 weeks, healing occurs, leaving a permanent scar 4 to 8 millimeters in diameter. Then mantox positivity develops usually after 8 weeks of injection. And if you are in our setup, you should have, like we said, it leaves a permanent scar, so you should have one on your left forearm. You should have one. If you don't, you can ask around people who were around when you are being given, or you ate, or if you are given BCG. Okay. Then if no scar appears after administering BCG, should one revaccinate the child? So this is what I wanted to tell you. So if you don't have the scar on where you are, if you, but this is for our setup. If since as we are given on the forearm, on the left forearm, so if no scar appears, or if you don't have a scar there, then you know that okay, I was given BCG. Should you revaccinate the child? So if you have given the child, then no scar appears. So should you actually revaccinate the child? So there is no need to revaccinate the child, even if there is no scar. If of course it was given, it was given. There is no need to revaccinate the child. Then contraindication to the BCG vaccinations. So we have generalized eczema. We can have infective dermatosis, pregnancy, states of reduced immunity, immunocompromised, such as you can have hypogammaglobulinemia, HIV positive with symptoms, which is symptomatic HIV, and you even on the under 5 card is there, symptomatic HIV, don't give BCG. You have congenital immunodeficiency, leukemia, lymphoma, generalized malignancy under chemotherapy. So the other question is, what type of immunity is mainly induced by giving BCG vaccine? So BCG vaccine predominantly induces cell-mediated delayed type hypersensitivity type of immunity. That's the type it induces. So that's the end of the tutorial. To short note on everything you need to know about BCG. Make sure you subscribe for more and hit the bell notification, and thank you for watching this video.